I've got a little photo here from my colleagues back in Mossel Bay. So you can see there's a family medicine resident or registrar, two medical officers who are doctors, primary care doctors without additional family medicine training, an operational manager of the clinic, and clinical nurse professionals. So I need to acknowledge also my supervisor, Professor Bob Mash, who has guided me over this project, which is an interesting one because we evaluated our impact. So imagine being you studying the profession that you're practicing yourself. So that's the whole, was quite challenging. It was a 2.5-year journey. And why was it necessary? So family medicine is relatively new for South Africa. One would think it's known across the world. There are people studying the evidence of family medicine from first world settings, but there's no real evidence from our setting. And I think that was the reason for this research, because at the policy level, there's a conceptual lack of clarity about what is our role and function. So in 2007, family medicine has been recognized as a specialty, and we have been more formalized in terms of our 6 roles. We are trained as expert generalists, working within primary care teams in district hospitals and community health settings. And graduates from the new training program have been entering the system about 5 years after, or 5 years before we started our research. So we wanted to set out to find evidence to help inform policymakers that could help everybody understand what is our role and how best to appoint us, because across the 9 provinces, family physicians are employed in completely different manners, and there's no real consensus. So our methods basically looked at designing using a conceptual framework, and we were asking ourselves about how do you measure the impact of a family physician or any healthcare worker. And family physicians are known for being team members, exerting their influence either directly or indirectly through the teams in which they work in primary healthcare, community-based settings. The relational aspect is key. Relation with the colleagues, relation with the patients, and striving for continuity of care. So we look at this ecological model with families, physicians we look at, one study looked at family physicians within a team, a 360-degree survey. There's one study that looked at the institutional level, comparing facilities with family physicians to those without. And we looked even at the district level, where we had interviews with district managers to find out what they thought about how family physicians are contributing to strengthen their own health system. And we look at the national level, where we look at the influence from national level. So, in a nutshell, and this is what we're going to, we have compiled a policy brief for health managers and policymakers. This is the findings from the study. I can point you to the articles that have more detail. But essentially, we are making impact. Although supply is very low, we only have, in a country where we have half the number of doctors per 100,000 compared to Brazil, which is supposed to be our equal counterpart, we have even less family physicians within our system. So we are making a difference, but it's very early days, and more research is needed. But there's a support from policymakers and the health system in confirming and appointing not only family physicians, but creating training posts. So, and hopefully this could also help to enhance the health system locally and in the African region. So the tide is coming in, hopefully. So we will be having more family physicians over the next few years. Thank you.